Alright guys, this is about my 15th time recording this intro, so if there's any mistakes, we're just gonna have to roll with it because I cannot record this intro anymore. So my name is Christian, I'm a pre-PA student. Today we're going to talk about the differences between the physician assistant and medical doctor professions. This video is not going to be about why I chose PA over MD. If you do want to check out something like that, my personal preferences, go ahead and check out the video I did a few weeks ago on my channel. This video specifically is going to outline the processes involved in each. So the pre-PA process, the pre-med process, what going through school actually looks like for each, whether you're going to medical school or PA school, how you apply, the statistics of each applicant going into PA school or MD school so you can see where you fit in, the actual processes of going through each. So we're going to talk about the length of school for each, the debt occurred for each, what the curriculums look like for each, the amount of training you get, the amount of clinical experience you get. And then after that, we're going to talk about the professions themselves. We're going to talk about what specialties a PA and MD can work in, what the work-life balance is like, job satisfaction, what the salary is like on average. We're going to talk about the highs and lows of each salary, the pros and cons of each profession. And we're just going to outline all in detail the facts and information about each of these professions, how they're viewed in the world, the current challenges of each, and the history and all of that, awesome stuff. So once again, this video is not going to be about my personal preferences. I'm going to try to keep this as unbiased as possible. If you do want to see a video about my personal preferences, why I chose PA over MD, go ahead and check that video out a few weeks ago on my channel. That video blew up, so I'm doing something similar in this. I hope you guys enjoy, and I'll see you guys in the video. So if you're going to be applying to PA school, you're going to be applying through a process called CASPA. That's just the online application or site that we use to apply to PA school. If you're going to be applying to a medical doctor school, you're going to be applying through AMCAS. So those are two differences right off the bat. The numbers I have here, the average GPA for a PA school applicant, somebody going into PA school, is going to be a 3.47. I think it's actually more so around 3.5, 3.6 is what I've seen personally at my school and programs I've looked at for the average applicant going into things. With PA school, they're typically going to have more healthcare experience because most of them have been, or some of them have been working, as a nurse for a few years before going to PA school. While they're in the pre-PA process, they're gaining healthcare experience. And you're going to see the same thing for an MD, but some programs don't require medical experience. It's highly, highly recommended to have medical experience. But most PA programs are going to require anywhere from 500 to even 2,000 hours of healthcare patient care experience. And that's just experience actually working in a healthcare setting. So that could be a CNA, physical therapist, aide, EMT, anything like that. Or it could be something higher level like a nurse, a registered nurse, anything like that. You'll see the same thing with an MDs. They're both gaining, healthcare experience. MDs might also focus on some research more, which PAs could also do, but it's not something that most pre-PA majors do. But research is something that the majority of MD applicants are going to want to focus on. So the standardized test for a PA takes before getting into PA school is going to be the GRE, and that's you focus on verbal and math. There's no medical or science stuff involved unless you take a specialty test, and that's dependent on each school. They are thinking of changing to a thing called the PA CAT, which is similar to the MCAT that medical students take. The average MCAT is about a 508 of accepted students. The average GRE is about 310 for accepted students. The average GRE overall is about a 300. So these are both standardized tests. They're going to cost you about $200 to take. And with the MCAT, you have things like organic chemistry, biochemistry. It's more science related and critical thinking than the GRE would be. Both require a bachelor's degree beforehand, And then when you go on to PA school, it's a master's degree. So it's 2 years. So the length of school is 6 years overall. 4 years undergrad, and then 2 years for your master's. And then after that, you go right into working as a PA. So the first year of PA school, you're going to school over the summers. It's nonstop. First year is didactic, which is classes, and then the second year is clinical rotations. So typically you're going to have about 10 rotations. You're rotating about every month or every 5 weeks to a new setting. You're going to do family medicine, emergency medicine, OBGYN, all that stuff, pediatrics. Whereas an MD, you're going to be in school for 4 years, and the first 2 years are didactic, and then the third year is somewhat a internship, and the last year is an internship. Then after that, so you're already 8 years in, 4 years undergrad, 4 years medical school. After that, you're going on to your residency, which is anywhere from 3 to 7 years. Now, this is a reason why I chose PA over MD. Now, I'm not, getting into my bias here. I'm just giving you an example of, for me, like what that means. So if I had gone on for MD, I wouldn't be actually practicing, like done with my residency, until I was 31 or 35, depending on how long my residency was. And that's something that really wasn't, an option that I considered. I'm not actually practicing, medicine as on my own until I was 31 or 35. Whereas a PA, I would be done and hopefully practicing medicine at 26. So there's a big difference there, almost, a 8 to 10 year difference depending on how long my residency was. So that's one of the pros of being a PA, is there's less time in school, and because of that there's less debt. So the typical debt for a PA student after graduation, not considering undergraduate, is going to be about $115. The average debt for a medical student, not considering undergrad, is going to be about $200,000 plus. I've heard stories about people even having $500,000 in debt. When you're in your residency, if you're living in a high cost of living area, you might not be able to even afford your living situation. You're working all the time, So that's another thing, is the residency takes up a very, very large amount of your time. You could be working 80 to 100 hours a week. Whereas PA school, you could be working from anywhere to like 40 hours a week. Probably going to be more so 50, but it could even be 60. So there's a lot more balance there. And again, it's only a year that you're in the actual clinical rotations. Residency is 3 to 7 years. Clinicals in PA school are not paid. Internships in medical school are also not paid. But you are paid in residency. I think it's typically like 50 to 60K a year. And then once you graduate medical school or PA school, the average PA salary is going to be about $115,000 a year. That's nationwide across all specialties. A medical doctor is going to be about $220,000 a year, depending on your specialty, and that's all nationwide. The majority of physicians are lower paying specialties like family medicine, pediatrics, internal medicine, stuff like that. So it's a little weighed down by that, because if you look at the range, it's anywhere from 75K in the bottom 10% to upwards of 650K in the top 10% if you're in a specialty like orthopedic surgery, cardiothoracic surgery. Emergency medicine is another higher paid one. Anesthesiology, stuff like that. The range for PA is 75K to 160K for the bottom 10%, the top 10%. The job satisfaction, according to surveys, is higher for PAs. PA was voted the #1 job according to the U.S. News in 2020, I want to say. Whereas physician across all specialties was the #5 job in the U.S. according to I believe it was a survey. Now, talking about the job market for both, the PA profession is growing much faster than the physician profession. The PA profession has actually seen a 31% growth projected for the future. I believe it's 10 years. The profession is projected to grow 31% based on how it performed in the past. Whereas the physician profession is going to grow about, I think it was 4%. So, you see a lot more job growth in the PA profession. And that's also due because the PA profession is somewhat newer. It had its first practicing PAs in the 1960s, the late 1960s, so it's only been around for about 60 years. Whereas if you look at doctors and physicians, they've been around for, back in, ancient times, some kind of precursor to what the profession is now. So, they're much more established and recognized by people, and that's an issue that's ongoing in the PA profession is patients, other providers, residents don't understand exactly what the PA MD role is. And since it's, a newer specialty, it's still ongoing. That process of PAs becoming more well known and more established. They're actually thinking of making a name change from physician assistant to physician associate to better represent our role as a PA. And some states, I believe Utah, have actually made the change to make PAs be able to be independent providers to where they don't have to have a supervising physician. And the way it works currently is a physician does not need to be physically present in the same building or facility as a PA. They just have to be available by phone call. So some PAs that I've talked to, haven't even talked to their supervising physician in, they might talk to them like once a month. Sorry about the cut there, guys. My camera stopped recording at 10 minutes for some reason, so I'm going to try to pick off where I left off there. I was talking about the name change from physician assistant to physician associate. So the bottom line is, since the PA profession is fairly new, there's still a lot of ongoing changes, and PAs, the PA profession as a whole, not that they're trying to find their place in medicine, they're trying to establish their place in medicine. They know, what they want to do, what their job is, but they need to find that spot in medicine and establish their place in medicine. So patients, better understand what's going on. So I think there's going to be a lot of growth in the future. PAs becoming more independent, similar to like what nurse practitioners are able to do, open their own practices, stuff like that. So I think PAs will be able to do that in the future. And then another thing I talked about while the camera was off and I was talking to the wall was it's much easier for PAs to switch specialties in an MD. So if an MD wanted to switch a specialty, they would have to go back and do another residency, which is another 3 to 7 years. And typically they wouldn't be able to work 2 specialties at the same time, which a PA could do, because the MD typically has to work full-time, whereas the PA might have some part-time opportunities available. So some PAs might work full-time family medicine during the week, and then on the weekends they might work emergency medicine, they might work urgent care, they might fill in for like an ICU shift or something like that. So there's a lot of lateral mobility available for PAs to work multiple specialties at the same time, or later in life if you want to switch to a less intensive specialty, like say you're in emergency medicine and you're getting towards a time where you want to retire. You might want to switch to something like general surgery or family medicine, and it might be hard to do that because you've been in one specialty for so long, and you don't have the experience in another specialty. It is possible. It might be hard, but it is possible. So that is an option for PAs, and that's definitely a pro for PAs. There is a discussion whether that affects patient care, and some people do see that as a scary thought, to see somebody who works in emergency medicine for so long, or in one specialty, and then switches to another one. So whatever your opinion is on that, that's something to consider. Once again, I'm not going to talk about my opinion here. The final thing I do want to say is that PAs are not recognized in all countries. There is not a equivalent profession in all countries for PA. I know there's one in the UK, which is the physician associate. I think Canada has it as well, and a few other countries, but it is just a handful of countries. Whereas MD is established, they have a equivalent career in each country. So it's, since it's been around for so long, it's very well established. So you could go, on a humanitarian aid kind of thing if you want to work overseas or whatever. As an MD, you could do that. Excuse me. As a PA, you would be limited in your scope of practice in other countries because they don't have the equivalent profession. So that's all I got to talk about. I outlined the pros and cons of each. PA versus MD. We talked about the pre-med process. We talked about what it's like being in school for each. We talked about the salary, post-grad debt, all that stuff. We talked about the nuances of each profession and the job outlook for each of them. So that's all we got to talk about today. Once again, if you guys want to hear why I chose PA over MD specifically, my reasons for that, go ahead and check out that video on my channel. It's a few weeks back, I think. And that's all I got today for you guys. I hope you enjoyed this little video talking about the facts here. And peace out. Alright guys, so if you haven't subscribed already, go ahead and hit that subscribe button if you want to see more pre-PA content. Eventually my journey through PA school. I'll be interviewing soon, so I'm going to be posting some stuff on that. So like this video if you enjoyed, and subscribe for more.